Hello, everyone. Thank you for joining us today. My name is Lizeth Santamaria. I'm a national board certified health and wellness coach. I'm also a lupus warrior, and I coach and support people that have lupus and other autoimmune illnesses to adopt a holistic and integrative approach to heal, improve their health and well being. And today I'm so honored to be here with Dr. June Chin. She is the Chief Medical Officer at LeafLaw. Dr. Chin, can you give us a brief introduction to who you are, maybe even your role at LeafLaw, anything that you would like to share?
Thank you so much. Thank you so much for joining me today. I've been so excited for us to meet and to connect because I'm a chronic pain survivor and also autoimmune. I have an autoimmune disease called ankylosing spondylitis. So I understand what it's like to go through the medical care system in the United States with a chronic issue. And it can be very, very daunting. When I was a medical student, I became a cannabis patient. So if it really wasn't for this plant medicine, I would not have become a physician. And now, decades later, I am the chief medical officer of the largest integrative virtual care clinic for cannabis in the United States. So we see patients across 37 states. We
Well,
have over 100 providers in 30 different specialties. So rheumatology, oncology, OBGYN, surgery. We work collaboratively with your local physician, but most importantly, we provide integrative cannabis care. So what that means is we help patients bring in plant medicine, such as cannabis, but also we are knowledgeable in conventional medicine. So prescription medication, whether it's talking to lupus patients about their biologics, if it's not working well, adding cannabis medicine to the regimen and making sure that we collaboratively work with your local doctor at home. So you really have the best of both worlds and you have 360 care.
that sounds amazing. Which honestly is what I want to talk to you about today is how we can talk to our listeners, educate them about how cannabis can be used as a holistic and integrative alternative to managing lupus and possibly other autoimmune symptoms. And so, with that being said, before we go into the discussion, I think it would be important for us to talk about a couple statistics when it comes to lupus. So, unfortunately, there are 1.5 million people in the United States that have lupus, and there are 5 million people diagnosed with lupus worldwide. And even more so for us to have this understanding, when it comes to people that are diagnosed with lupus, 9 out of 10 people that are diagnosed with lupus have are women. And so it is so important for us as women who have autoimmune illnesses to really advocate and talk about how to manage lupus and other autoimmune symptoms. It's such a huge topic, and another thing that I want to bring up that is important to February, which is the month that we're in, it correlates with Black History Month. The racial and ethnic groups that are highly at risk for being diagnosed with lupus include people of color. So that includes African Americans, Asian Americans, Hispanics, Native Americans, Pacific Islanders. And so having that understanding, it's important to acknowledge that people that are a part of these ethnic and racial groups experience health disparities in terms of the severity of their disease, increased mortality rates, even understanding that access to the appropriate medical care is not always available and accessible to them. And so these disparities are things that we need to start talking about. And so when it comes to exploring a holistic and integrative approach that includes cannabis, can you talk to us about how cannabis could be helpful to people when it comes to these ethnic groups and these racial groups?
Well, I'm so glad you brought that up because these health disparities are so real. And I think more so even for women. Oftentimes when we go to the doctor and there is a chronic issue or we're not being helped by conventional medicine, this gabapentin, this Lyrica doesn't work anymore, or now the biologic doesn't work anymore. Yes, I've tried that NSAID. Yes, I've tried that Cymbalta. And after a while, the providers will dismiss you and think that, you know what, you just need to go see the psychiatrist because chronic pain you can't see. These flare-ups you
Right.
can't often see. So when you think about a health provider or a coach, you really want someone that's culturally competent, that
Mhm.
understands where you're coming from, what your background is, understands how to integrate plant medicine or maybe integrate other modalities like acupuncture or massage or nutrition without diminishing the belief systems that you have. And it's very tricky to find a health provider and a coach that will stand by you and advocate for you. So I'm so glad you brought up those statistics because it's so important, and I can't agree more.
Absolutely. Absolutely. I believe you hit the nail right on the head. And that's why it's so important that me as a holistic health and wellness coach and you as a physician are having this discussion.
And that's what's part of an integrative team. So you don't always have to think of, I need to go see my doctor, I need to see my health provider. You might need to see your health coach, your nutritionist, your personal trainer. You might need to just call your best friend or, an auntie and say, "Well, what do you suggest? Should I use these warm compresses, for my back or for my stomach? Or I've tried castor oil. What other options do you have?" It is really a community approach when it comes to healing.
Absolutely. And we, the patient, we are a part of that community approach. So it takes us advocating for ourselves, especially because lupus and autoimmune illnesses are invisible, as you shared. And so, if any physician or our medical care team is going to really help us, that means that we have to be in tune with ourselves, mind, body, and soul. We have to communicate our symptoms, any changes that are happening prior to medication, prior to or after taking cannabis. And that way we can customize our plan of care. And that's the beauty of a holistic and integrative approach, especially using cannabis. And so when it comes to holistic care, we are looking at all aspects of this person, this individual. And so when we take a look at integrative care, is that correct in saying that we are able to use holistic methods of care integrated with the traditional medical care that we receive today?
So integrative medicine means you're combining the best of both worlds. So you're looking at the best of plant medicine, nutrition, maybe you're looking at acupuncture, massage,
Hmm.
exercise, right? Exercise, lifestyle changes, whether it's balancing your circadian rhythm. And then you're looking at things like biologics. Maybe you're using um, a prescribed antidepressant, anti-anxiety medication. Maybe you're using an NSAID that's prescribed to you or a gabapentin or a Lyrica and you're combining that with your complementary alternative medicine so that perhaps you don't need to keep going up on those biologics. Perhaps those biologics don't plateau, right?
Yes.
So it's not one or the other. It's not, I'm only going to use cannabis medicine. And if cannabis medicine doesn't work, then it has failed me. It's really about finding that meeting point of plant based medicine, complementary medicine, and conventional medicine.
Absolutely. Thank you for explaining that to our listeners. That's definitely within the realm of coaching that I support and that I advocate for and that I follow myself. Following a holistic and integrative approach has helped me to reach lupus remission and to really calm down my symptoms and decrease medication. And so I'm such an advocate for it. And with that being said, I think that a customizable approach for anyone that has lupus is typically what they're looking for because lupus is not a one size fits all. Everybody has different symptoms. Typically, when you have an autoimmune illness, there's different symptoms that show up for the individual. And so we need a really refined person to person medical plan of care. And so I reached out to my community and I have gathered really amazing questions that I wanted to ask you that we can inform everybody that's listening. So, when it comes to lupus, systemic inflammation is one of the extreme causes of a lot of the symptoms. Can you tell me what role cannabis plays when it comes to systemic and chronic inflammation?
So the hundreds and hundreds of compounds in the cannabis plant really serve as a great anti-inflammatory. So I am talking about CBD, but I'm also talking about other cannabinoids in the plant, flavonoids in the plant, terpenes in the plant. There is a synergistic um, magic, if you will, in the cannabis
Yes.
plant that serves as an anti-inflammatory. So when we look at lupus or some of the other symptoms that lupus patients might have, it could be irritable bowel syndromes, right? It could be,
Mhm.
I flip-flop between constipation and diarrhea during my flare-ups. I don't have a regular, bowel movement. It always flip-flops between one or the other. That's an inflammation in your GI system, which can affect other parts of your body. It can affect your joints, right? If you're not eating well, you're not digesting well, then you start feeling, well, my joints are getting swollen. My knee wasn't swollen yesterday, but I woke up in the morning and all of a sudden that knee is swollen. So I think everything is interrelated. The body functions as a unit. If you look at how we view medicine, it's you see your GI doctor, your gastrointestinal doctor if it's a stomach problem. You might see your neurologist if it's a nerve problem or your psychiatrist. When we look at integrative medicine and we bring in plant medicine, and that beautiful anti-inflammatory effect, it starts to hit all of the organs. You start to look at GI, you look at respiratory, you look at hormones, you look at, your endocrine, you look at your musculoskeletal system. So you start thinking of your body as functioning as a whole.
Yes. Well, I'm so glad that you went into that because the majority of people that have lupus, inflammation tends to affect their organs. And so the main organs that are affected, and this is just, some of the list. This is not all of the organs, but commonly affected organs from lupus are the heart, inflammation of the kidneys, the lungs, the brain, and the gut, which you've mentioned. So, with that being said, as far as someone that is exploring cannabis to reduce the inflammation, if we look at that integrative approach, can they continue taking their medications while they are exploring cannabis?
Of course, this is not direct medical advice. I always say you have to talk to your health provider. But clinically speaking, in our experience, in my experience, what we've seen is patients will find that their prescription medications work that much better when they add a potent anti inflammatory like cannabis medicine. Of course, they would also think about making sure that you have anti-inflammatory diet. So certain foods that might trigger your lupus symptoms, keeping a journal about that as well. So I'd be remiss if I don't talk about nutrition. But when you bring in plant medicine, which includes the foods that you eat, you are tampering down that inflammation and you're getting ahead of it instead of chasing the inflammation. So you're decreasing that root cause of
Mhm.
your GI issue, brain fog, of the swollen musculoskeletal system.
I love how you said that as far as that we are not being reactive, we're actually being proactive to reduce that inflammation instead of waiting until the inflammation creeps up and then we have all this pain. Then we're actually taking a proactive approach with a customizable plan that includes cannabis. So you mentioned one of the symptoms that a lot of people typically have. And so it's important to understand that inflammation causes the chronic pain, which causes joint pain, can also lead to difficulty sleeping, lower energy levels. So, can you tell us how decreasing the inflammation can help with some of these symptoms?
So if you decrease the inflammation and get to the root cause of the problem, you will sleep better. You'll be able to be more active and you'll be able to exercise, right? You'll be able to function better. Your bowel movements will be a little bit normal, so you'll be able to feel and absorb the nutrition and feel better,
Yep.
absorb nutrition of
Hmm.
foods and feel better. So it really has a cascading effect. And I think it's also important to say that there is a body mind connection with your gut. So if a lot of lupus patients will tell us, like, I just feel like bloated all the time. I feel like there's a band around my stomach or around, my upper GI. It feels like almost like reflux. And patients will say, I don't feel like eating today, or all I had was, bread and some juice. That is going to affect your cognition over time. That's going to affect how you sleep at night. So when you're decreasing inflammation, I would say with the GI tract and your muscles, it will just have a domino effect and you will be able to function that much better.
I have to agree with this. I feel like I shout it from the rooftops anytime I can. Taking a holistic and integrative approach and exploring cannabis as an alternative method to help me heal and manage some of my symptoms has been so amazing. Not only was I able to achieve remission by doing the lifestyle changes that you discussed, but what doing exercise, moving my body, managing my sleep, reducing stress, focusing on my nutrition, all of that has helped me to reduce the inflammation. And on top of that, I will say that cannabis has really helped when you talk about a mind body approach, the connection that we have here. When we're able to calm our body, we can also calm our mind, and that helps to calm our spirit, which leads to a peaceful, energetic demeanor versus one that's chaotic and full of inflammation and chronic stress. And so it does work all hand in hand. I'm such a believer in this. And so when it comes to the mind body approach, as we said earlier, health is not just physical, it's also mental and emotional. And I know that me myself, I've dealt with mental health issues, feeling depressed, going through anxiety, having a chronic autoimmune illness, having the symptoms, possibly going to a physician and not feeling understood or heard. It can be frustrating and really affect your emotional and mental state. And cannabis has really helped me when it comes to managing my mental and emotional, as well as the physical. Can you tell us some ways that cannabis definitely helps with your mental and your emotional state?
So, cannabis works really well at calming your sympathetic nervous system. So, we have two parts of our nervous system. The sympathetic nervous system is our fight and flight, right? It helps us get ready for that 9 a.m. meeting, that deadline. It's us running away from the bear. It's our
Yes, we're on
adrenaline.
alert.
We're on alert.
Yes.
And then our parasympathetic system helps us with digestion and sleep and sex and relaxation. When we have chronic inflammation, patients with autoimmune disease, patients with chronic inflammation and flare ups, their nervous system is heightened because even though it looks like you're at rest, you could be sitting on your couch and it looks like you're relaxing. Your body is inflamed. Your nervous
Yes.
system is high. Your body is on alert. It's almost like I actually had a patient that with lupus that said, "It feels like I'm vibrating inside, but it you doesn't look like I'm vibrating inside, but inside my nervous system just feels like it's on fire all the time." Now that's gonna create anxiety in itself. That will create depression, panic attacks. When you bring in plant medicine, cannabis, it actually works on the GABA receptors in your brain, so it actually tempers that. It actually helps you feel grounded. It almost feels like you did yoga or you went for a run. So
It really does.
it turns the volume down on that sympathetic overdrive so that you can feel a break, you can feel rest. The great thing about cannabis medicine is there are daytime formulations that you can take without feeling altered or feeling euphoria, feeling high if you need to drive, if you need to run errands, take care of your family, if you need to work or if you need to, speak, public speaking, you can use cannabis medicines that are great for daytime. So you remain clear, but still decrease that pain, inflammation, and decrease that sympathetic overdrive. And then there are formulations that will help you sleep at night and stay asleep. For women, it's our hormones. So we might need a little more cannabis depending on our cycle. So a lot of times women will say, especially with autoimmune, I use more cannabis, this time of the month. Does that mean my tolerance is going up? And I always say, no, it's part of it is the autoimmune, part of it is the flare-ups, but part of it is your hormones. So you might need to figure out there are days where I'll need more, and there are days where I feel great and I could come down on the dosage. And that's why it's so important to work with a health provider that's knowledgeable and that's culturally competent, that understands your condition.
Yes, yes. Check, check,
Okay.
check. I'm so glad that you tied that all together. That makes complete sense to me. So culturally competent and that, can empathize and really listen and be there for you. When it comes to dealing with an invisible illness, that's what a lot of autoimmune illnesses are and lupus. And so having a provider that will actually listen to you. Pain is not visible, and so, inflammation is not visible. And so being able to have that discussion with a trusted provider that is able to educate you, now I know your symptoms, I know your concerns, let's figure out which cannabis strain is the best
Mhm.
for you is key. And so that brings me to my last question. Can you tell us about terpenes? What are they? How are they used for selecting the best strain?
That's a great question. So terpenes are the smell molecules of the cannabis plant, and there's so many different ones. And you'll actually find terpenes in your kitchen. So if you think of ginger, cloves, thyme, rosemary, they have terpenes just like the cannabis plant. And there are strains or chemovars that have a more of a linalool or like a lavender terpene, and that helps
Mm.
with relaxation, that helps with sleep. There are terpenes that are more citrusy, a limonene, and that actually will help uplift your mood. A lot of our patients that use limonene chemovars or strains that cannabis plant that has that terpene as a dominant terpene will find that they can focus more in the daytime. So there are different terpenes that are suitable for your condition.
Yes, that is so helpful. And also to help anyone that's listening, correct me if I'm wrong, Leafwell, if you go to the site, you can do a search and type in terpenes. Could I say that correct? Okay. And then you can see a list of different categories, and that can help you start that discussion with your provider.
Exactly. And I would say if, the research it is daunting. If you look at our website, we have a research dashboard and there's thousands and thousands of research out there, but you can actually go down to the condition that you're looking for and even the body part. So if you're looking for research just on lupus and the musculoskeletal system, then you can look that up. Or if you're looking for the lupus and GI system, because a lot of our patients will say, you know what, I need to talk to my provider, but I need to come with research so that I come prepared. Sometimes lethal patients will, we co-collaborate with local providers. So they'll look up the research. They will advocate for themselves. So they'll look up the research, they'll bring us in as a lethal provider, and then they will go see their rheumatologist or their oncologist. So it's a team approach. And that's the way medicine should be. That is good medicine.
Okay, so cannabis can actually be added to the medical plan of care for someone that has lupus or another autoimmune illness.
Yes, but it also depends on the state. So I do want to shout that out. Lupus might, depending on where you are, depending on the state that you're in, there's certain um, qualified medical conditions. And
Hmm.
lupus might not be on that list as qualified medical conditions, but as you and I know with autoimmune diseases and with lupus, there are other qualifying conditions like chronic pain, musculoskeletal pain, or wanting an alternative to opiates, right? So that could be a qualifying condition.
Even
Anxiety,
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 depression.
depression,
Yes, yes,
insomnia, right?
yes.
Those are also qualifying conditions. So wait, you might not think that, okay, well, I have lupus, so and it's not a qualifying condition in my state. Those other conditions are, and you can check those boxes.
Yes, and I will say that, I live in Orlando, Florida. When I was filling out my application for my medical marijuana card, I was instructed and I was guided through Leafball, which was really helpful, that asked certain qualifying questions to help me really correlate between the other symptoms that I was having, that even though I don't see lupus listed there as a qualifying condition, there are other conditions or other qualifiers that I
Yes.
can list and share so I was able to get approved. And so I will say the Lethal website was extremely helpful in helping me get approved for my medical marijuana card.
Fantastic. We love to hear that.
Yeah. Yes, absolutely. Anything else that you think that we didn't touch on that we could really add to this discussion when it comes to cannabis, lupus, autoimmune illness, holistic and integrative care, anything at all.
What I love and what I wanna underline and leave our listeners with is something that you said is not everything will work, but you have these different things in your toolbox that works. So for you, right, thinking about lifestyle changes, thinking about alternative medicine, maybe cannabis is not gonna work absolutely, but if you combine it with, resting and sleeping better, hot compresses, maybe you'll combine
Mhm.
it with a yoga session. So pulling these different levers is much more effective than relying on just one modality on its own.
100%. And I'm so glad you said that. I truly believe in synchronicities. And I literally just had this discussion with one of my coaching clients prior to our discussion for today about making sure that they have their toolbox and they can select depending on what their triggers are, what their symptoms are. You can have so many different ways to help. And that is the awesome thing about exploring holistic and integrative care. It's not just a
Exactly.
one size fits all. We can use multiple things to heal, improve our health and well being. Dr. Chin, you are amazing. I am honored to be able to have this discussion with you. Thank you so much. I'm sure all of our listeners have learned a lot today during this discussion. And if they want to get in touch with you, where can they find you?
Leafwell.com. I think that the website is really great because it tells you about how to get medical certification, but also we have such a robust education and research. So if you're not ready to get your medical certification, or if you're using the website as a resource for a family member or friend that might be hesitant about medical cannabis, there are really a plethora of information, and our blogs, our socials. We do health awareness webinars every month, so you can always tune in. We talk about, things from irritable bowel to chronic pain to fibromyalgia to lupus month. So please join us every month for new content and to engage with us.
Wonderful. Thank you so much. And if you are looking to find me, Lizeth Santamaria, you can go to my website, thelupuscoach.com. You can also find me on Instagram or social media at the Lupus Coach, or you can do a search for my name and I will be there. Thank you so much. Bye. Have a good one.
Thank you.